Hey everyone, my name is Jay and I am a massage therapist, and I'm going to do a series of videos on some post-surgery massage, whether that's you doing some self-massage, you watching these videos with a friend or partner and having them help you out. But basically I'm going to show you some techniques that I use in my own practice as a massage therapist, and also want to give a big disclaimer that I am not a doctor. So anything I'm sharing today, please run it by your doctor as you're recovering, or better yet, talk to them about it before surgery. Make sure you're clear on your own situation and, things that I don't know about you that you might need to factor in. So, I can kind of give some broad timelines around, when you might be able to do this. But if you're having any, specific thing that, goes wrong post-surgery or during surgery, that's really going to affect the timeline of when it's okay to do massage, and especially when it's okay to do some of these certain techniques that I'm going to show you. So please, make sure that you have the guidance of a doctor, physical therapist, etc., that y'all are on the same page about when you should be really manipulating the body, because some of this stuff is pretty powerful. So let's always, exercise caution as you're going in, and treat the body gently. Other things I want to say right from the beginning is that, I'm really grateful for a lot of the knowledge that I have gotten from teachers of mine and just from working with my clients. This stuff that I'm going to share with you over the series is not stuff that I learned in massage school, right? It's I was fortunate to be able to do an apprenticeship with someone else who has this area as a specialty, Francis Reed, who taught me a lot about fascia, who taught me a lot about scar tissue. So a lot of that information is thanks to them and that apprenticeship that I did with them. A lot of the kind of additional information about manual lymph drainage and just kind of some other massage techniques is thanks to wonderful practitioners as well, teachers, writers, Kathy Ryan and Nancy Keeney Smith. So thank you to those humans for allowing me to share this information with you today. So you heard me mention some words that you might not have been familiar with, or maybe you do. So going back to kind of the three sections of things that I'm going to be showing you. So manual lymph drainage. I am not a manual lymph drainage specialist. I do not have the training. There's a lot of extensive training that you can do around it. I just know a tiny bit that I can safely incorporate into my own practice and I can share with you. But again, if you have some serious swelling that's not going away, find a lymph drainage specialist. Ask their advice. Make sure you're checking in with your doctor, especially about anything that you're doing around swelling. You might have what's called a contraindication, a reason to not do that kind of massage, that kind of body work. I'm going to today to be talking a lot about top surgery recovery in particular, but a lot of the clients that I work with, actually all of the clients that I work with post-top surgery, they have had their gender affirming surgeries, but it's not a situation in which they're they've had like breast cancer or undergoing chemotherapy, like all of those kinds of things change the game big time. So again, check in about your specific situation with your medical care providers. All right. So going back to the areas that we're going to be talking about. So lymph drainage, scar tissue release, and myofascial release. This is kind of the combo that I approach folks with after surgery. So, what are the things that I just said? All right, so let's talk about lymph. So, our lymphatic system, we have lymph nodes in different areas of our body. You can kind of think of them as like collection sites almost for lymph fluids that are like moving through. You know, a lot of times you might be more familiar with your lymph nodes when they get swollen when they're trying to fight off an infection. So very important parts of the body. If you want to know more extensively about lymph, just the internet is an abundance of knowledge. I'm just going to touch on it a little bit today. But basically, what's happening post-surgery is, you know, there's been a physical trauma, an intentional physical trauma of the surgery, hopefully addressing things in a way that don't have too many complications. But again, like a lot of times complications can happen. So maybe there's additional swelling that you didn't anticipate. So what's happening with that swelling? Basically, the body is trying to heal, right? It's everybody, all parts of your body. Sometimes I refer to the body as everybody. Everybody is trying to go to the site of injury or of surgery to heal that, right? So like everybody's being recruited, and what ends up happening is then we get excess fluid in those areas. We get excess scar tissue in those areas. So initially it's great that scar tissue is there and building itself. Initially it's great that there's, you know, that we've got some fluid coming towards the area to clear things out. However, after, you know, things calm down, incision lines have healed and are getting stronger, you know, we don't need scar tissue to just keep hanging out there. We don't need that extra fluid to just keep hanging out there. So that's where these kind of interventions come in that I'm talking about today. So we'll talk about some lymph drainage stuff. We'll also talk, I said, about scar tissue itself. Scar tissue is going to look different depending on which type of top surgery you've had or other surgery. This video can also apply to other surgeries as well, but I'm not going to get into those specifically. So, and again, I'm talking about top surgery where tissue has been removed, not added. Although much of what I'm saying can apply, but again, consult with a doctor to find out what can apply. So, scar tissue, basically similar to what we were talking a minute ago about, you know, everybody come and try to help to heal the area. So let's imagine like this line on my shirt is a scar line. So what's happened at that scar line is now I've got, you know, just imagine the scar line is all healed up, but I've got something in there, right? Like there's some extra tissue, kind of feels hard, not sure what that's about. Also, when I lift my arm, why does it feel like it's pulling? Like, what's that about? Why do I feel like I'm kind of stuck, or there's just this pain now, when I like try to move my body around that it feels like pulling almost. So what's happening with all that? A lot of times, when scar tissue is forming, when the body's trying to heal itself, it's just concerned about like getting that healed up, like as quickly as possible, closing those gaps, getting that line, where the incision was, really like solidified. It's not, scar tissue isn't like, oh, let's lay down a nice even pattern that's just going to allow for the same amount of flexibility and movement as before. No, it's just trying to fix the hole that's in your body. So Francis described scar tissue to me, how it lays down as like, imagine, you step on some gum and you lift your foot, and now there's all these like tendrils of gum that are coming up on your shoe. You've got this like kind of gooey mess, these long strings. Scar tissue can be like that. It might not even like be in the spaces that you expect it to be. Like you might have, some scar tissue that has kind of shot off the path. Right? Like, it's like, oh, that didn't need to go there, but, you've got scar tissue below or above the actual incision. That can happen. You could also have it right along the incision. The fascia below and above your, like, incision site, like, also might be kind of hardened. Okay, what do I mean by fascia? Fascia is kind of, you can think of it as like connective tissue in our body. If you imagine like your body is basically like a big spider web, you kind of pull on the spider web, up through your hair, and everything else follows. We are big chains of connective tissue that, everything influences each other head to toe. So we end up having fascial patterns in our bodies that get created based on if we slouch, if we sleep on one side of our body all the time, if we like bind our chests, if we wear a backpack only on one side all the time, if we have just had surgery and are on bed rest, all of these things are creating patterns. Our bodies are regenerating in ways that, they're trying to honor like how we're living our lives, right? They're like, oh, you sit like this all the time, so you must want me to like reinforce how you sit. So like, let's reinforce that pattern. And you might start to notice a bit of like kind of a hunch in how your body's looking. That's just, reinforcing the pattern. So a lot of the things that I'm going to be showing you are kind of giving a little opportunity for a different way for the fascia to be, a different way for our bodies to exist, a little challenge to some of those patterns that we find ourselves in. Excuse me. So with fascia can get involved with scar tissue as well. So maybe you've kind of got some tight, tense fascia from having to wear a binder after top surgery, or from like sleeping like this. Maybe that, that tight, tense fascia is in the same area of your scar tissue, so you've kind of got both things going on at the same time. So we're going to talk about doing just general the importance of doing some general fascia release, but most of that information is going to be in a series of videos I already did, so I'm not going to repeat myself. I will simply link those videos, and you can find those videos and check that out. It's basically my one disclaimer on that, though. The fascia release that I show in the other videos is assuming you are pre-surgery. It's like all stuff that's good to do before surgery, and also just in general in our lives. And kind of maintaining some flexibility and kind of challenging those patterns that we fall into. That is, those videos are not assuming that you have just had a surgery. So you need, for example, to make sure that you are at an okay recovery point, that you're not like lifting your arm and like opening up a scar line. We don't want to be doing any of that. That's only going to lengthen the healing process. So, once you get the okay, for example, to lift your arms, then you can do the parts of the videos that involve lifting your arms. Otherwise, just keep it otherwise just keep it to what is appropriate at your level of healing process of how you can move your body. All right, so what else? Timing wise, again, really person dependent. If you haven't had anything go wrong with the surgery, everything kind of went as planned, and again, I'm specifically talking about top surgery right now. Other surgeries certainly can be different. If somebody comes to me, I will start, probably 6 or more weeks out from surgery, if they haven't had any complications. And I will, at around that time period, I will only start if the scar line is nice and closed up. There's no like kind of pimply stuff that looks open. I'm not going to be touching any kind of open scar line. When it's you touching your own body, again, your doctor might advise something sooner. But the kind of touch is going to be very different at a few weeks out versus a few months out. You can be much more aggressive later on, once you're really not needing that scar tissue to do its job anymore. With lymph drainage stuff, that can be started pretty quickly after surgery. We're more in the days range stuff, but again, that is not my expertise, so talk to a lymph drainage specialist about that. Talk to your doctor about that. With the fascia release work, again, if that is done away from the scar line, you're not right on it. If you're doing it away from the scar line, just say here's scar line. If you're doing it up here or down here, that might be able to be okay earlier than 6 weeks as well, only if you are making sure that you're not doing something super intense and you're never pulling your skin or muscles or anything away from the scar line. You're always going to want to go towards, because we don't want any accidental pulling apart of the scar line. We don't want any, you know, extra pressure on it. So I will get into what all that looks like in the next videos. All right. I'll pause there. I know that was like kind of a brain dump, so I hope that was helpful just in kind of knowing some of the background information. Next videos will be hands-on.